How to do Pap smear, conventional and liquid-based cytology, HPV test by practitioner, by Cecilia Lave and Cecilia Evangelista, Master Trainers. Success, Japago, Philippines. PAP smear screening tool to diagnose early lesions in the cervix, even when there are still no abnormal signs and symptoms. The cervical specimen is taken from the exocervix and the endocervical area and smeared on a slide to be processed and read through the microscope. This is called conventional Pap smear. Later, the liquid-based cytology technique LBC was developed and improved the Pap smear yield. The exocervical and endocervical specimen were collected using a brush. The process for HPV testing by practitioner is the same step-by-step procedure for Pap smear. Conventional Pap smear. Use the cervix brush to get specimen from the exocervix and endocervix. This brush is smeared on the glass slide. Glass slide with specimen soaked in alcohol or use fixative spray. This slide is processed in the laboratory and read by the pathologists under the microscope. LBC liquid-based Pap smear and HPV test. LBC Pap smear and HPV test, collected by the practitioner following the same steps. It uses the same collection kit brush with preservative bottle. Specimen is collected by the brush from the endocervix and exocervix and dipped into the preservative, twirled 5 to 10 times, so all the specimen are transferred to the solution. The specimen is labeled and preservative bottle closed and spill avoided. This will be processed in the laboratory, as seen on the left. Result specifies the HPV type. Steps in doing Pap smear and HPV test provider collected, counseling on HPV testing, and for self-collection of sample. Welcome the woman respectfully and with kindness, greet her and offer a seat, and introduce yourself. Ask about last normal menstrual period and family planning. Determine possibility of pregnancy. Find out how much the woman knows about HPV and HPV testing. Explain HPV testing to the woman and how the sample can be collected, self-collection or provider collection. Respond to the woman's needs and concerns about the HPV testing. Encourage questions. Determine that the woman has decided to have HPV tests done. Obtain verbal informed consent.